The prevalence of mental health disorders among young people in this country approximates that of adults, and their impact may be even greater in youth because they strike during critical periods of educational, emotional, and social development. "50% of mental health disorders begin before age 14 and 75% before age 24, affecting the learning and school experience for all children. Nationally, suicide is the second leading cause of death of adolescents 15 to 19 years old. Suicide was the second leading cause of death for Georgia children ages 10 to 17 years old in 2018. The number of children in Georgia who visited emergency departments for reasons related to suicide doubled between 2008 and 2018. The problem for teens is that their underdeveloped frontal cortex means that they have trouble seeing ahead or understanding the consequences of their independent decisions or acts. They are more susceptible to suggestions such as copycat self-harm and even suicide. They're often impulsive and unable to see past their pain and suffering. Many factors can play into the increased risk of reasons why. Relationship problems such as a breakup, violence, or loss. People who have experienced violence such as child abuse, bullying, or sexual violence have a higher suicide risk. The breakdown of families, homelessness, and the presence of stressful events are other social and environmental risk factors. Suicide can cause serious emotional, physical, and economic impacts. If attempted and survived, people may experience serious injuries that can lead to long-term effects on their health, such as depression and other mental health concerns. According to the CDC, protective factors buffer individuals from suicidal thoughts and behaviors. For example, ongoing quality health care for mental, physical, and substance abuse disorders. Easy access to a variety of clinical interventions and support. Development of strong skills for nonviolent conflict resolution and problem solving. Suicide is preventable, and everyone has a role to play to help save lives and to create healthy relationships with others. Being connected to family and community support can help decrease suicidal thoughts and behaviors. Whether you are a teacher, a coach, a youth leader, or a family member, you can have an influence on youth in your circle of influence. Willowbrook offers school-based therapy and medication management, telehealth visits for both therapy and medication. In-clinic face-to-face visits, and a partial hospitalization program, which is an after-school outpatient program for children and teens. Together, we can help youth and adults in our communities become the best version of themselves.